Sexually transmitted diseases are rapidly increasing among older adults. It might sound ironic, but this is a reality that is ringing alarm bells throughout the global healthcare community. In recent years, reports from the Centers for Disease Control and Prevention in the United States have revealed that the rates of sexually transmitted diseases, such as syphilis, gonorrhea, and human immunodeficiency virus, are rapidly increasing among people over the age of 60. Even more alarming, many individuals are completely unaware that they are infected, believing, at this age, what is there left to worry about? Why are these diseases, which have long been thought of as problems of the young, now exploding among retirees and those who have long passed their prime? Are we underestimating the sexual lives of older adults? Or has silence, embarrassment, and a lack of education about safe sex at this age created a deadly blind spot? In today's video, we are going to uncover 5 surprising reasons why sexually transmitted diseases are silently spreading through the elderly community. Along with that, we will highlight early warning signs, harmful habits that must be eliminated immediately, and most importantly, how to protect yourself and your partner in a respectful, discreet, yet incredibly effective way. Stay with us until the very end, because the truth revealed at the end of the video might make you reconsider some seemingly harmless aspects of your private life. Before we get started, leave a positive comment as a personal commitment to your health. For example, I cherish my body and my health every single day. And do not forget to like and subscribe to our channel so you can continue to join us on this journey toward comprehensive healthcare, with no judgment, no prejudice, only truth, knowledge, and sharing. Why are sexually transmitted diseases increasing among older adults? Let us explore the real reasons behind the rapid rise in sexually transmitted diseases among older people in recent times. The first reason is a revolution called erectile dysfunction medications. Viagra, Cialis, and Levitra, once seen as medical miracles for middle-aged men, have now become familiar companions for many older adults. These medications not only improve erectile function, but also rekindle a long-lost sense of confidence, the feeling of still being attractive, still being desirable, and most importantly, still being themselves. It is undeniable that thanks to these small pills, millions of older adults have been able to revive their sex lives, extend feelings of intimacy, and even enhance their overall emotional well-being. These medications are not just medicine. They symbolize the idea that old age can still be vibrant, romantic, and full of passion. However, hidden within that newfound joy lies a serious gap in awareness. Many individuals see erectile dysfunction medications as a magic wand that restores their virility, forgetting one crucial truth: being physically able to engage in sexual activity does not grant immunity from sexually transmitted diseases. The renewed confidence, the feeling of being young again, like in their 20s, if not accompanied by proper knowledge and safe sexual practices, can quickly lead to risky overconfidence. In fact, many older adults, especially those in new short-term or non-committed relationships, have completely abandoned the use of protection, assuming there is no need anymore. Next, improved health, but outdated knowledge. Thanks to groundbreaking advances in modern medicine, coupled with healthy nutrition and consistent exercise habits, older adults today are not only living longer, but also staying healthier and more active than ever before. Even at 60, 70, or 80 years old, many can still maintain a positive, romantic, and emotional life. However, this physical revival has not been matched by an upgrade in awareness. Many older individuals still cling to outdated misconceptions about sexually transmitted diseases, believing that these are problems only for reckless young people or those in improper relationships. Such distorted thinking has caused many to underestimate the dangers and neglect the importance of protecting themselves in new relationships. Moreover, a large number of older adults still associate condoms solely with pregnancy prevention, because they think, at my age, there is no chance of having children anymore. They completely forego using protection, especially when entering non-committed relationships, such as online dating, short-term dating, or finding partners after divorce or widowhood. This mindset has inadvertently opened an invisible door for sexually transmitted diseases to infiltrate silently. Because viruses and bacteria do not care how old you are, how many children you have, or whether you live in a nursing home or a luxury retirement community. It is not just a physical issue. The rise of sexually transmitted diseases among older adults reflects deeper social and psychological problems. When we talk about sexual health in older adults, we cannot ignore the powerful influence of social and psychological factors on their choices and behaviors. 1. Loneliness and emotional deprivation. One of the most critical factors that make older adults more vulnerable to unsafe sexual relationships is loneliness and emotional deprivation. After losing a life partner, or when family members are no longer living nearby, many elderly individuals experience a profound sense of isolation and a lack of emotional connection. This loneliness often creates an intense need for closeness and affection from others. For many older adults, sex is not merely a physical need, but also a way to feel loved and connected. Because of this, some are willing to engage in unsafe sexual encounters, even with people they barely know, simply out of a deep desire to be loved and to share emotional intimacy. When loneliness takes hold, people tend to seek out closeness without fully considering the health risks involved, which significantly increases the likelihood of contracting sexually transmitted diseases. 2. The connection between sexuality and psychology. The psychological state of older adults plays a crucial role in their decision to engage in sexual relationships. At an advanced age, emotional vulnerability is heightened, especially when dealing with major life changes, such as the loss of loved ones, declining health, or the feeling of being forgotten by society. These factors can create a sense of insecurity and emotional fragility, driving many to seek new emotional relationships to compensate for the void in their lives. Additionally, when there is a lack of emotional sharing and empathy, older individuals may suffer from diminished self-confidence, making them more likely to agree to unsafe sexual encounters without paying attention to protective measures. 3. The rise of unprotected sexual services. Another alarming issue is the increase in unprotected sexual services within the older adult community. Some older women driven by economic hardship or emotional deprivation may engage in sexual relationships without using condoms or other forms of protection. Many older adults, especially those living alone or with limited incomes, easily fall into this situation. They might not be fully aware of the risks associated with unprotected sex, simply because they were never properly educated about safe sexual practices. This lack of knowledge creates a massive gap in their health protection, making it much easier for sexually transmitted diseases to spread within the older population. We cannot blame them. The truth is that they were not given sufficient education about safe sex. Society has not encouraged open conversations about their genuine needs, nor provided many safe spaces for healthy sharing. And when these legitimate needs are buried for too long, they tend to surface in ways that carry significant risks. From the psychological and social factors analyzed, we see that the sexual health landscape for older adults is becoming more complex than ever. But to truly grasp the severity of this issue, we need to look at the actual numbers happening right here in the United States, a country with a highly developed healthcare system, high life expectancy, and yet also one witnessing a silent surge in sexually transmitted diseases among its aging population. According to reports from the Centers for Disease Control and Prevention over the past 10 years, the rate of people aged 65 and older contracting sexually transmitted diseases such as syphilis, gonorrhea, and chlamydia has doubled. In just the last 5 years alone, the rate of syphilis has increased by 29%, gonorrhea by 17%, and human immunodeficiency, virus and acquired immunodeficiency syndrome by 14% among adults, with the group over 65 years old accounting for a significant portion of this growth. These numbers are not just dry statistics, they are a wake-up call for the entire healthcare system and the community of older adults. Furthermore, places often considered safe and private, such as nursing homes, retirement communities, and senior living areas in populous retirement states like Florida, California, and Arizona are becoming silent hotspots for the spread of sexually transmitted diseases. Many couples in these settings do not use condoms simply because they believe, at this age, pregnancy is not an issue anymore. But they forget that another critical reason for using condoms is to prevent sexually transmitted diseases, which do not discriminate by age. A recent survey conducted by AARP, the American Association of Retired Persons, highlighted this concerning reality. Nearly 60% of older adults admitted to not using condoms during sex. Over 70% had never received advice from a doctor about sexually transmitted diseases, and nearly 1/3 had no idea that they could still contract STDs at their age. This represents an enormous gap in community awareness and is the inevitable result of a healthcare and sexual education system that has not yet adapted to adequately cover this rapidly aging demographic. In addition, we cannot overlook the role of social media and online dating apps, such as Tinder, Our Time, and Silver Singles. Today, older adults, especially those who are single after divorce or the loss of a partner, are increasingly joining these platforms to seek new companions. Another serious issue is the ageism that still exists within the healthcare system. Many doctors feel awkward or hesitant when it comes to discussing the sexual lives of older patients. Some even assume that older individuals are no longer sexually active, so they do not ask, they do not check, and they offer no advice. As a result, many cases of sexually transmitted diseases go undetected until clear symptoms or severe complications arise, often when it is too late for effective prevention. For older women, the situation is even more critical. After menopause, the vaginal lining becomes thinner and more sensitive, making it more prone to injury and infection, which significantly increases the risk of contracting sexually transmitted diseases compared to men. However, many women remain silent out of shame or fear of being judged as improper for discussing sexual matters at an advanced age. The consequence is that untreated sexually transmitted infections can persist and lead to severe complications, such as chronic inflammation, secondary infertility, or even cancer. Clearly, sexually transmitted diseases are not just an issue for the young, and sexuality does not end at a certain age. Modern society is changing. Older adults are living longer, staying healthier, and having clearer emotional and sexual needs. But the healthcare education and media systems have not yet caught up with this reality. If we continue to ignore older adults in public health campaigns and sexual education initiatives, a silent but widespread public health crisis will be unavoidable. Sexuality has no age, and neither do sexually transmitted diseases. Only awareness and proactive action can serve as true shields no matter how old you are. Here are some practical and simple recommendations for older adults to protect themselves. 1. Actively use protection. During sexual activity, there is nothing shameful or awkward about using condoms at an older age. On the contrary, it is an act of respect for both yourself and your partner. Condoms are not only for preventing pregnancy, they are also the most effective shield against sexually transmitted diseases. Older adults should normalize the use of condoms, and if needed, have a gentle conversation with their partners about it. We both want to stay healthy and safe, right? 2. Get regular health checkups. When you go for a medical checkup, do not hesitate to discuss your sexual life with your doctor, even if you are in your 60s, 70s, or 80s. Sexual health is a crucial part of overall well-being. Ask your doctor about sexually transmitted disease, screenings, hormone levels, or anything else you might find unusual. If your doctor does not bring it up, you still have the right to ask. Your health is your responsibility. 3. Be honest. When entering a new relationship, if you are starting a new romantic relationship, whether through friends, social media, or a dating app, be upfront with your partner about health issues, including regular sexual health testing, condom use, and the desire for a healthy lifestyle. Honesty is the foundation of any long-term relationship, and it is the first layer of protection for both parties' health. 4. Do not trust. Gut feelings. Trust medical tests. Never judge a partner's health based solely on their appearance or a sense that they seem clean. Many sexually transmitted diseases show no obvious symptoms in the early stages and can spread silently for years. The only way to be certain is through regular testing and open communication. 5. Educate yourself. Knowledge is the strongest weapon. You are never too old to learn something new. Take the time to educate yourself about sexually transmitted diseases, early warning signs, and effective prevention methods. Organizations such as the American Association of Retired Persons, the Centers for Disease Control and Prevention, and Planned Parenthood offer free and easy-to-understand resources and workshops that are specifically designed for older adults. Remember, early knowledge, early action, healthier living. Experts are also paying close attention and proposing practical, actionable solutions to prevent sexually transmitted diseases. 1. Rebuilding sexual health education for older adults. One of the most necessary and urgent steps is to redesign sexual health education programs, no longer limiting them to young people in schools, but expanding them to include older adults as well. This means providing clear, non-judgmental information about sexually transmitted diseases, methods of prevention, early warning signs, and the importance of regular testing. Workshops, educational materials at nursing homes, senior community centers, and even smartphone applications, if designed appropriately, could become powerful tools to improve understanding and empower individuals to protect themselves and their partners. 2. Integrating sexual health into routine checkups for older adults. Doctors and healthcare workers must recognize that sexual health is an inseparable part of comprehensive care. At any age, therefore, many experts suggest that during routine medical examinations, there should be a few gentle and respectful questions about emotional well-being and physical intimacy. Even a few carefully asked questions can create an opportunity for openness and help detect potential risks early. The American Geriatric Society has also emphasized older adults have sexual lives and they deserve comprehensive care. They must not be neglected due to outdated assumptions. 3. Increasing regular screening for sexually transmitted diseases. Testing for diseases such as human immunodeficiency, virus syphilis, gonorrhea, and chlamydia should be included in standard health checkups, especially for those who have new partners or who are active in lively community environments. This is a critical step to detect diseases, early prevent complications, and limit their spread. In addition, healthcare centers should enhance friendly communication efforts, using flyers, posters, and casual discussion sessions to help reduce the fear or embarrassment often associated with these topics. 4. Eliminating stigma and respecting older adults. Right to a healthy sexual life. Finally, and perhaps most importantly, older adults have the same right to love, intimacy, and emotional fulfillment as anyone else. No one should be made to feel guilty or ashamed of seeking natural human connection, whether by societal judgments or even from family members. Psychologists affirm that caring for sexual health is not only about the physical body, it is about affirming dignity, respecting autonomy, and enhancing quality of life. A truly civilized society is one where no one is left behind, where even in old age, individuals can live with love and understanding. Because sexuality has no age, and neither do sexually transmitted diseases. But knowledge, awareness, and respect are the boundaries that every person can and should establish to protect themselves. Today's older adults are no longer standing outside the realm of emotional life, and they must not be left out of the conversation about public health. The desire for love, the yearning for closeness, and the need for connection are legitimate human needs that do not fade with age. However, alongside these desires must come proper education, protection, the right to be heard, and the right to be respected, just like anyone else. No one should be left behind just because of outdated beliefs like old people do not care about sex anymore. This is not merely a story about disease. It is a story about human dignity, about the right to choose one's way of living, and about how truly progressive a society can be. Sexuality has no age. Sexually transmitted. Diseases have no age, but knowledge, awareness, and respect are the personal limits we must proactively set to live safely, freely, and peacefully. If you find this content valuable, please share it. You can share it with a partner, a loved one, or simply keep it for yourself. Sometimes just one piece of timely information can open a new door for better health, stronger trust, and more proactive living in later years. And if you want to add your voice to the movement for a more civilized and compassionate vision of aging, feel free to leave a comment like "I support a safe, proactive, and dignified older age," or any heartfelt thought you would like to share. We are always here to listen. Please click like on the video and subscribe to our channel, because only through understanding can we truly live better together.